This is Ramin Tayani, MD, ophthalmologist and oculoplastic surgeon. I'm a board-certified ophthalmologist and medical director of DERMABARE. Wanted to introduce Ida Pedar, one of our nurses, who's quite experienced and has been with us for almost 15, 16 years now. Today we're going to talk about, Ida, what are we talking about?
Morpheus 8 and PRP.
PRP. So Morpheus 8 is a product of a radio frequency technology. It's one of the products of InMode, which is one of the companies that has a fantastic radio frequency product. We actually have a few of their devices. Morpheus 8 is one of them. FaceTight, AccuTight, and Evolve, which we have different videos on. And this video we're going to concentrate mostly on the Morpheus 8 with and without PRP, and how they differ, what the benefits are, and what the outcomes are, and why is someone a candidate for it. So Ida does most of those procedures herself. So you want to tell us a little bit more?
If you're familiar with microneedling, it's a little bit similar to microneedling, but very advanced because it has a radio frequency on it. And it's a cosmetic treatment to focus more on reboot and rebuild our collagen, which we lose it by age. Yeah, and if we know the setting of the Morpheus, we can see the best result because it's not even compared to microneedling because it's
so it is microneedling. It's just that more advanced, like you said, right?
And radio frequency.
Yeah. So the tip of the needles are actually probed with the radio frequency technology, and so it penetrates the skin, goes deep to the skin at the collagen level, and works on the area in the subdermis area, dermis area. We have the ability to gauge how far and how deep we want to go. We can set it from anywhere from 1 to 5 millimeters of depth. So different parts of the face, for example, the forehead area or over the bony areas, we might want to go less depth, whereas in some areas like the cheek, we might want to go more depth. And then combining the PRP is a fantastic augment to what the microneedling or the radio frequency alone can do.
Yeah, and if you have like acne scar or any scar tissue for pores, for a deep line, whatever it's bother you, just do Morpheus 8. And at the top of that, you can add PRP, which we draw the blood, we put it on the machine, and we separate the collagen, which is platelet with blood, and I draw it separated. And while your skin is open with microneedling, we can apply the PRP on your face, and it penetrates the collagen directly inside your skin. And also we have the opportunity to draw it in the for injection, the area it's bothering you, like we need to
nasolabial folds or
everything, all of them we can inject it, and it gives you a little bit volume, but not like filler, which is, we talk about it in the next video.
Right. So Ida brought up a good point. You know, who is a candidate? Why would you even do this? So one of the key points with Morpheus 8 is it's blind to the skin color. As you'll learn in some of our other laser videos, one of the benefits of laser is it tightens the skin. However, one of the things that we have to be cautious about is the skin color that some people are more or less of a candidate for. With the Morpheus 8, because it penetrates the skin, it's not at the surface, you actually are safe treating any skin type. And it penetrates underneath the skin, works underneath the PRP, seals those micro-needled wounds, and helps the healing and get the results that we want to see.
Yes.
What's the before and after care on these procedures? Do they have to do anything before to prepare?
Yes, actually it's good to hydrate themselves because of the blood drying, and also...
And how can they get hydrated, by the way, quickly?
Quickly, IV.
So we have IV therapy at DERMABARE, which again we have a separate video for, but we do IV hydration for people who have a little bit too much fun the night before, or anything, if they just want to get hydrated or be pre-treated for their Morpheus.
Yes, and also the aftercare is very important. That for 24 hours, I recommended not touching their face because it's open and the skin is very sensitive, and don't wash it with the strong cleanser, and don't use retin or hydroquinone 2 days or 3 days before treatment, and 2 days and 3 days after treatment. Also, what else?
There's not much bruising, but that's a potential that anyone can get bruising. How about pain level?
And also we make it numb with a very strong numbing cream, which is prescription. You always prescribe it, and we make it numb before treatment.
And there's really not much pain after the procedure. It's
After
a little bit of a, would you say it's a little warmth?
Like sensation.
And, okay.
Yeah.
Treatments take about 20 minutes, 30 minutes? How long does it take?
30 minutes.
About 30 minutes to do. And again, you could drive yourself. We do have an additional opportunity to use nitrous oxide for pain for those people who are super sensitive. We can give you the laughing gas to also take care of the pain as well. But most people don't have enough pain to require that.
None of them, they don't use it.
You don't use it?
They're comfortable with the numbing cream, yeah.
Okay. So, any other things that we need to cover? Well, why DERMABARE? Why come to DERMABARE as opposed to going anywhere else? Well, first of all, not everyone has the Morpheus 8. That's a very expensive technology that we have instead of just microneedling. But again, I think it goes back to our providers. Our nurses are great. They've been doing this for many years. I'm on site or close, very close, within minutes away at any given time. My cell phone is on 24/7. If there's any issue, you can always call me. We do give our patients my cell phone number. And I think we have great customer service, great availability.
Yeah.
Our consultant is very knowledgeable, and our nurses are excellent. So, anything else?
Okay. Great.
Well, thank you for joining us on this video. Again, this is Dr. Tayani, the medical director at DERMABARE, and Ida, one of our nurses at DERMABARE. Have a great day. Till next time.